supporting your kidney and prostate function through nature's remedies. Good morning and welcome. I want to start by asking you something personal. When was the last time you slept through an entire night without getting up to use the bathroom? If you're like most men over 55, you probably can't remember. Those nighttime trips have become so normal that you've stopped expecting anything different. But what if I told you that waking up 2, 3, or even 5 times a night isn't just annoying, it's actually a signal that your kidneys and prostate need support? Today we're going to talk about something doctors rarely discuss: how your kidney function and prostate health are intimately connected, and how supporting one naturally helps the other. I'm going to share 4 foods that work on both organs simultaneously, plus a simple nighttime ritual that could change your sleep quality within days. Right now, before we go any further, I need you to do something. Click that subscribe button and turn on the notification bell. I release new videos every week covering topics specifically for men over 50, issues that mainstream medicine often overlooks or simply throws quick prescriptions at. Your support helps this channel reach more men who deserve clear, practical guidance, not confusion or guesswork. Don't miss out on information that could genuinely improve your daily quality of life. Brazil nuts. Let's start with something you've probably seen at the grocery store but never thought about for kidney or prostate health. I'm talking about Brazil nuts. Your prostate tissue contains higher concentrations of selenium than almost any other organ, and research from the University of Arizona has shown that men with higher selenium levels have significantly lower rates of prostate problems. Selenium works as a powerful antioxidant, protecting prostate cells from oxidative damage that accumulates over years and leads to inflammation and enlargement. But here's what most people miss about Brazil nuts and kidney function. Your kidneys are constantly exposed to oxidative stress because they filter enormous amounts of blood every single day. That filtering process generates free radicals that can damage delicate kidney tissue over time. The selenium in Brazil nuts helps neutralize these free radicals, protecting your kidney cells and supporting long-term kidney function. Brazil nuts also contain healthy fats that help reduce systemic inflammation throughout your body. When inflammation decreases, both your kidneys and prostate function more efficiently, because they're not constantly battling inflammatory compounds circulating in your bloodstream. Now, let me tell you the preparation trick that older men find most effective, and this is something that dramatically improves how your body absorbs and uses the selenium. Don't eat Brazil nuts on an empty stomach first thing in the morning. Instead, soak 3 Brazil nuts in water overnight, just like you might soak beans. In the morning, drain them and eat them with a small amount of healthy fat, like a spoonful of Greek yogurt or a few slices of avocado. Why does this matter? The overnight soaking begins to break down compounds called phytates that can interfere with mineral absorption. The healthy fat you eat them with helps your body absorb the fat-soluble nutrients in the nuts more completely. This combination ensures maximum benefit for both your prostate and kidneys. Here's the crucial warning about Brazil nuts that you absolutely must understand. More is not better with these nuts. Because they're so high in selenium, eating too many can actually cause selenium toxicity, which leads to hair loss, brittle nails, and digestive upset. 3 to 4 nuts daily is the sweet spot. That's it. No more. In short, this simple nut offers remarkable support for both your prostate and kidney health when used correctly each day. With just a small, consistent dose, you help reduce inflammation, protect your cells, and keep these 2 essential organs functioning stronger as you age. If you found this information helpful, don't forget to hit the like button so this video can reach more people who need it. Once you've given your body that morning boost, the next support comes from something that works deeper, right at the level of circulation. Beets. Now we're going to talk about beets, and I know some of you are already making a face because you remember disliking beets as a child. Stay with me, because what I'm about to share could change your mind, and more importantly, could significantly improve your urinary system function. Beets contain natural nitrates that your body converts into nitric oxide, and nitric oxide is like a master key that unlocks better blood flow throughout your entire body, including to your kidneys and prostate. The Cleveland Clinic has published extensive research on how dietary nitrates improve vascular health and organ function. When blood flow to your kidneys improves, they can filter more efficiently and require less effort to do their job. This improved efficiency means less strain on your kidneys overnight, which often translates to better sleep quality and fewer interruptions. For your prostate, better blood flow means better oxygen delivery, which supports healthy tissue and helps reduce the inflammation that causes that constant feeling of pressure and urgency. Beets also contain a compound called betaine that helps your liver process fats more efficiently. Why does this matter for your kidneys and prostate? Because when your liver functions better, it produces fewer waste products that your kidneys need to filter. It's like lightening the load that your kidneys carry every single day. Less work for your kidneys means they stay healthier, longer, and function better even as you age. Here's something remarkable about beets that relates directly to nighttime urination. Beets help your body maintain better fluid balance by supporting healthy blood pressure. When your blood pressure is stable and healthy, your kidneys don't trigger excessive nighttime urination the way they do when blood pressure fluctuates or runs consistently high. Here's the elderly-friendly secret that makes beets work even better for prostate and kidney health. Combine your roasted beets with a drizzle of extra virgin olive oil and a sprinkle of fresh parsley. The healthy fats in olive oil improve absorption of beet nutrients, while parsley contains compounds that support kidney function and act as a natural diuretic, helping flush your system during daylight hours. You can also make what I call kidney prostate beet juice, but this is not the same as buying commercial beet juice from the store. Take a quarter cup of your roasted beets and blend them with 8 ounces of water, half an apple for natural sweetness, and a thumbnail-sized piece of fresh ginger. Blend until smooth. The fiber stays in this preparation, which is important because it slows down sugar absorption and supports digestive health. If you're learning something new that could actually help your daily comfort and sleep quality, take a moment to hit that like button. It takes 1 second, but it helps this video reach other men who are struggling with the same prostate and kidney issues. Your like could lead someone else to information that changes their quality of life. With blood flow taken care of, the next step is supporting how your kidneys clear out what doesn't belong. Parsley. Now we come to parsley, and I'm not talking about that decorative garnish restaurants put on your plate that you push to the side. I'm talking about fresh parsley as a powerful therapeutic food for your urinary system. Parsley contains compounds called apigenin and myristicin that have remarkable effects on both kidney and prostate function. Apigenin acts as a natural anti-inflammatory agent specifically in the urinary tract. It helps calm inflammation in your prostate gland, which is often the root cause of that constant urge to urinate and the feeling that you can't completely empty your bladder. Research from the American Botanical Council has documented parsley's traditional use for urinary system support, and modern studies have confirmed these benefits. Parsley also works as a gentle natural diuretic, but unlike pharmaceutical diuretics, it doesn't strip your body of essential minerals like potassium. In fact, parsley provides potassium while encouraging healthy urine flow. This combination helps your kidneys maintain proper electrolyte balance while efficiently removing waste and excess fluid. The myristicin in parsley has been studied for its ability to help prevent bladder infections by creating an environment less hospitable to harmful bacteria. Since chronic bladder infections can trigger prostate inflammation, this protective effect benefits both organs simultaneously. You can also use fresh parsley in your daily cooking to get milder, consistent benefits. Chop a quarter cup of fresh parsley and add it to your eggs in the morning. Sprinkle it over soups or salads at lunch, or mix it into ground meat dishes at dinner. Just consuming this amount daily provides continuous support for both organs. When buying parsley, always choose fresh over dried because the beneficial compounds degrade rapidly once the herb is dried. Look for bright green leaves without yellowing or wilting. Store fresh parsley in your refrigerator with the stems in a glass of water covered loosely with a plastic bag. Change the water every couple of days and your parsley will stay fresh for up to 2 weeks. Be aware that parsley can interact with blood-thinning medications like warfarin because of its vitamin K content. If you're on blood thinners, check with your doctor before using medicinal amounts of parsley. Also, people with kidney disease who need to limit potassium should use parsley in moderation and discuss it with their healthcare provider. Some men notice increased urination within hours of drinking parsley tea. This is exactly what's supposed to happen during the afternoon and early evening. Your body is clearing excess fluid and waste, so your kidneys don't have to work as hard overnight. Most men find that after a few weeks of regular parsley tea consumption, their nighttime urination decreases noticeably. And once your system is flushing efficiently, we add something that calms inflammation from the inside out. Turmeric. Our final food is turmeric, and this golden spice is probably the most researched anti-inflammatory compound on Earth. The active ingredient in turmeric is curcumin, and curcumin has been shown in hundreds of studies to reduce inflammation throughout the entire body, including specifically in the prostate gland and kidney tissue. The Journal of Urology has published research showing that curcumin can help reduce prostate inflammation and improve urinary symptoms in men with benign prostatic hyperplasia. That's the medical term for an enlarged prostate. For kidney health, studies from the National Kidney Foundation have examined how curcumin protects kidney cells from oxidative damage and supports healthy kidney function even in people with early-stage kidney disease. Here's what makes turmeric special for nighttime urinary issues. Chronic inflammation in your prostate creates swelling that presses on your urethra, making you feel like you need to urinate even when your bladder isn't full. Curcumin reduces this inflammation, which relieves pressure and reduces false urges. For your kidneys, less inflammation means more efficient filtering with less energy expenditure, allowing better overnight recovery. Turmeric also supports healthy circulation by improving the flexibility of blood vessel walls. Better circulation means better oxygen delivery to both your prostate and kidneys, supporting their ability to function and repair damage. Here's my recommended preparation that elderly men find most effective and gentle on the stomach. This is called golden paste, and it's a traditional Ayurvedic preparation. Mix a quarter cup of turmeric powder with half a cup of water in a small pot. Add half a teaspoon of freshly ground black pepper. Heat this, gently stirring constantly until it forms a thick paste, which takes about 7 to 8 minutes. Remove from heat and stir in 1 to 2 tablespoons of coconut oil while the paste is still warm. Store this golden paste in a glass jar in your refrigerator, where it will keep for about 2 weeks. Take 1 teaspoon of this paste daily, either mixed into warm milk, stirred into soup, or even eaten straight off the spoon if you don't mind the taste. The best time to take it is with dinner or shortly after your evening meal because the fat in your meal further enhances absorption. If you prefer to use fresh turmeric root instead of powder, that's even better. Fresh turmeric looks similar to ginger but has a bright orange interior. You can grate fresh turmeric into your food, blend it into smoothies, or juice it. Some people experience mild digestive upset when they first start taking turmeric regularly. If this happens, reduce your dose by half for a week, then gradually increase. Taking turmeric with food rather than on an empty stomach also helps prevent digestive discomfort. Before we move to the final technique, I want you to do something. Hit that share button and send this video to someone you know who's dealing with prostate or kidney issues. This information is too valuable to keep to yourself, and you might genuinely improve someone's quality of life by sharing it. It takes 5 seconds and could make a real difference. Here's a simple way to naturally support both your kidney and prostate health. Start your day with nutrient-rich foods that offer strong antioxidant and protective benefits. Add circulation-boosting vegetables to your lunch to help your kidneys filter more efficiently. In the afternoon, use a gentle herbal drink to keep your urinary system active during the day and reduce nighttime interruptions. In the evening, take an anti-inflammatory warm drink to support overnight healing. And before bed, finish with a short routine that improves pelvic blood flow and helps your body manage fluids more comfortably. None of these steps requires major lifestyle changes or expensive supplements. Everything I've shared uses common foods and simple techniques that fit naturally into your daily routine. The key is consistency. Give your body 3 to 4 weeks of consistent support, and you should notice real differences in your symptoms. Most men report their first noticeable change is sleeping through more of the night without waking to urinate. Within 2 weeks, you might notice less urgency during the day and a more comfortable feeling in your lower abdomen. After a month, many men find they have more energy because they're getting better quality sleep and their organs are functioning more efficiently. You don't need to implement everything at once. Choose 2 or 3 strategies that seem most manageable and start there. As they become habits, add the others. Small, sustainable changes create lasting results and actually stick, while trying to change everything overnight usually leads to frustration and giving up. If this video provided you with practical information you can actually use to improve your daily comfort and sleep quality, please subscribe to this channel right now. Click that subscribe button and turn on notifications so you don't miss future videos about natural health support for men over 50. Thank you for investing this time in your health. Here's to better sleep, more comfortable days, and taking control of your well-being through natural proven methods. Take care. Terrifying truth, the 3 nuts saving your kidneys and the 3 slowly poisoning them. Did you know that every time you casually snack on a handful of tiny nuts, you might be slowly poisoning your kidneys, which have already grown weaker with age? It sounds unbelievable, but according to research from the National Institutes of Health, nearly 37 million Americans are living with chronic kidney disease, and 90% of them have no idea they're carrying a ticking time bomb inside their bodies. The scariest part is that sometimes the culprit isn't medication or genetics, it's hidden right in the foods we think are healthy and eat every single day. Just one wrong snacking habit repeated over the years can push your kidneys into overdrive, raise your creatinine levels, cause toxins to build up, and silently destroy kidney cells without you ever noticing. Then one morning, when your lab results come back and your doctor tells you your kidneys have already lost 40% of their function, you'll wish you had known this sooner. So how can you protect your kidneys before it's too late, avoiding dialysis and other painful complications? Here's the good news. Some nuts can actually protect your kidneys, purify your blood, lower creatinine levels, and extend the lifespan of kidney cells if you know how to choose the right ones. In today's video, you'll discover 3 amazing nuts that can save your kidneys and 3 others that may seem healthy but can silently harm them if you don't stop in time. Stay tuned, because just a few minutes from now you'll know exactly which nuts are healing you and which ones are quietly destroying your kidneys every day. Subscribe and turn on the notification bell so you never miss the knowledge that could save your health today. 3 nuts you must eat. 1. Sunflower seeds. On those warm May days when you see fields of golden sunflowers stretching to the horizon, few realize that hidden inside each tiny seed lies a natural remedy for tired, aging kidneys. Sunflower seeds aren't just a familiar snack, they're like little beams of light that help your kidneys recover and cleanse themselves after years of dealing with high blood pressure, sugar, and salt accumulation. Their power lies in vitamin E, one of the strongest fat-soluble antioxidants. For adults over 50, kidneys often face damage from free radicals created by metabolism and long-term medication use. The vitamin E in sunflower seeds helps neutralize these radicals, protecting the delicate nephron cells from microscopic damage. When the cell membranes are protected, your kidneys filter blood more efficiently, creatinine levels may drop slightly, and the progression of chronic kidney disease can be naturally slowed. A compelling example comes from the 2019 NHANES study by the National Institutes of Health, which followed 2 adults aged 55 to 75 with mild kidney impairment. After 6 months of consuming an average of 15 milligrams of vitamin E daily, mostly from sunflower seeds, the group showed a 22% average improvement in glomerular filtration rate, eGFR, and a 17% decrease in proteinuria compared to the control group. Here's a little-known tip. Before roasting, soak sunflower seeds in warm water at around 40 degrees Celsius for 4 hours, then rinse and drain them. This step removes part of the phytic acid. When roasting, use a dry cast iron pan and stir constantly over low heat for about 10 minutes until a light aroma appears. Seniors should eat about 1 tablespoon of roasted sunflower seeds a day, mixed into porridge or plain yogurt to enhance vitamin E absorption. This small habit makes digestion easier and significantly reduces inflammation caused by salt buildup in the kidneys. But you know what? Beyond sunflower seeds lies another type of nut that acts like armor for your body's blood filtering system. Don't miss what's coming next, because what I'm about to share might completely change how you see this nut. Hit like now so you won't forget that sometimes a single tiny seed can change your entire kidney recovery journey. 2. Macadamia nuts. There's a saying I love that goes, "Nothing feels as smooth as the buttery melt of macadamia on your tongue." But what few people know is that this creamy texture doesn't just soothe your senses, it can also soothe your tired kidneys burdened by age and high blood sugar. For older adults, macadamias aren't just a luxurious treat, they're like a natural oil therapy for the kidneys. What makes macadamias special is their high content of palmitoleic acid, also known as omega-7, a rare monounsaturated fatty acid. Omega-7 helps reduce inflammation and repair the renal tubule cells damaged by excess glucose, one of the leading causes of kidney failure in adults over 60. It also improves the flexibility of cell membranes, boosts blood flow to the glomeruli, and supports tissue regeneration in chronically inflamed kidneys. In 2020, the University of Queensland conducted a study called MACREN 2020 involving 1118 patients with type 2 diabetes and mild kidney impairment. Those who consumed 15 grams of macadamia nuts daily for 6 months saw a 28% reduction in proteinuria and an average eGFR improvement of 6.3 points compared to the control group. You should eat 4 to 6 macadamia nuts daily, ideally in the morning, about 30 minutes after breakfast when your stomach isn't empty and your kidneys begin their first filtration cycle of the day. For better omega-7 absorption, pair them with a slice of apple or pear. The natural pectin in these fruits emulsifies the fats from macadamias, making digestion smoother and reducing bloating. Always store macadamias in an airtight glass jar in the refrigerator, as omega-7 oils are sensitive to light and temperature and can oxidize within 48 hours if left in open air. The true power of macadamias doesn't lie in luxury, it lies in consistency. Just a few nuts a day, and over time your body will feel the difference. But the journey to protecting your kidneys doesn't end here. Don't go anywhere yet. Hit subscribe to discover the sweet secret hidden in the next nut, a natural gift quietly extending the lifespan of seniors day by day. 3. Pecans. In the southern states, pecan trees aren't just grown for their nuts, they're seen as symbols of strength and longevity. Every autumn, when the pecans fall, people believe it marks a time of cleansing and inner renewal, a belief that modern science is now beginning to confirm. Pecans are rich in magnesium, an essential mineral that helps regulate blood pressure, relax blood vessels, and improve circulation within the kidneys. When blood vessels are relaxed, the nephrons can function more easily, reducing pressure and preventing the formation of kidney stones. Magnesium also helps neutralize excess calcium in urine, which lowers the risk of kidney calcification, a condition that many older adults suffer from without even realizing it. According to a 2021 study published in the American Journal of Clinical Nutrition, researchers followed 1087 adults over 60 who were at risk of developing chronic kidney disease for 12 months. The group that consumed around 350 milligrams of magnesium daily from pecans showed a 31% reduction in the risk of CKD progression and a significant improvement in eGFR levels. However, there's a small but crucial detail few people know. Pecans oxidize easily if stored improperly, and when that happens, the natural oils in the nuts break down into peroxides, compounds that can cause kidney inflammation. To avoid this, seniors should store pecans in an airtight glass jar in the refrigerator along with a few dry roasted coffee beans. The coffee absorbs moisture, preserves the natural aroma, and prevents the oils from turning rancid. When you're ready to eat, take out a small portion and let it sit at room temperature for about 15 minutes to soften. This not only maintains the nutrients, but also allows your body to absorb magnesium more effectively. Just a few pecans a day can nourish weakened nephrons and make your kidneys feel rejuvenated after years of exhaustion. But sadly, not every nut brings such miracles. In the next section, you'll discover the shocking truth about some nuts that seem harmless but are silently destroying your kidneys day by day. If you believe this information could help a friend or loved one avoid a dangerous mistake, share this video now. A single small act today could protect someone's kidneys for a lifetime. Dry nuts. You should never eat. Eins. Peanuts. Have you ever wondered why something as seemingly harmless as peanuts, a staple in almost every snack, makes kidney specialists shake their heads in warning? While many believe peanuts are a great source of protein for older adults, the truth behind that crunchy, buttery shell is something that should alarm anyone over 50. Peanuts often contain aflatoxin B1, a toxin produced by Aspergillus mold that thrives in humid conditions. Once inside the body, aflatoxin doesn't just damage the liver, it also attacks the nephron cells in the kidneys. In older adults, the kidney's ability to regenerate tissue is already weakened, so even a small amount of aflatoxin can inflame, scar, and destroy nephron function. In 2022, the Centers for Disease Control and Prevention released a study following 1342 seniors who regularly consumed industrially processed peanut products. The findings were alarming. This group showed a 36% higher risk of elevated creatinine and reduced kidney filtration function compared to those who ate little or no peanuts. The report also revealed that their blood aflatoxin levels were 3 times higher than the safety threshold set by the FDA. If you love the rich taste of peanuts but want to protect your kidneys, replace them with unsalted pistachios, a much safer and healthier choice. Pistachios are rich in lutein and beta-carotene, which protect kidney blood vessels from oxidative damage. For older adults, eating 15 to 20 whole pistachios after lunch each day provides sufficient protein without straining the kidneys. Choose lightly roasted pistachios at low temperatures and avoid flavored varieties. You can also grind them and mix with plain Greek yogurt for a creamy, kidney-friendly afternoon snack. It's a small tip, but an incredibly effective one. It's heartbreaking to realize that a food meant to energize you can end up shortening your kidney's lifespan. And you'll be even more shocked to learn that some so-called premium nuts, those often marketed as clean and healthy, can cause even deeper damage than peanuts. Hit like if you once thought peanuts were a healthy choice, because what's coming next will make you rethink everything you believed about almonds, the nut once known as the favorite of the health-conscious. 2. Almonds. Some foods are hailed as symbols of health, yet they hide a silent nightmare beneath their perfect shell. Almonds are one of those deceptive foods, seemingly safe and nutritious, but capable of driving aging kidneys to exhaustion. While younger bodies can easily eliminate the high levels of phosphorus found in almonds, those over 60 process it far less efficiently. As phosphorus builds up, it increases phosphate levels in the blood, triggering a chain reaction that disrupts calcium balance throughout the body. The result is overworked kidneys, faster nephron scarring, and a gradual loss of filtering ability. Doctors at the Mayo Clinic once described this condition as forcing an old car to climb a hill non-stop without ever letting it rest. A major 2021 Mayo Clinic study tracked 1026 patients with stage 2 and 3 chronic kidney disease. The group that consumed an average of 40 grams of almonds daily experienced a rate of eGFR decline twice as fast as those who avoided almonds. These findings shocked the American medical community, raising a serious question: are so-called superfoods truly suitable for everyone? If you still crave the light nuttiness and pleasant aroma of almonds, there's a safer and more beneficial alternative: walnuts. They contain 60% less phosphorus and are rich in omega-3 fatty acids that reduce inflammation and improve kidney blood flow. Older adults can soak walnuts in warm water for about 10 minutes before eating to soften them, making them easier to chew and helping lower residual salt and phytic acid. Eating 15 to 20 walnuts per day is the ideal amount to provide healthy fats without stressing the kidneys. But the story doesn't end there. If almonds are the traitor disguised in a nutritious shell, the next nut is even more dangerous, a perfect imposter in countless clean-eating diets, silently etching scars onto your kidneys that never heal. Share this video now, because what comes next may change the way you look at the small, innocent seeds you've been eating every day. 3. Pumpkin seeds. There's a quiet paradox hidden in the daily eating habits of millions of older adults. Many believe that eating pumpkin seeds helps cleanse the body, lower cholesterol, and protect the heart. But few realize that this seemingly healthy habit may be paving the way for painful kidney flare-ups that strike without warning. A closer look reveals that pumpkin seeds are extremely high in oxalates. Oxalates are harmless for healthy kidneys, but for aging kidneys with declining function, they're a dangerous spark. Once inside the body, oxalates bind with calcium to form tiny crystals in the urinary tract. Over time, these crystals cluster together into stones that scrape kidney tissue, causing inflammation, bleeding, and eventually reducing blood filtration capacity. The end result, kidney fatigue and failure. A 2020 study published by the nephrology department at Johns Hopkins University sent shockwaves through the medical field. Researchers tracked 1,417 people with a history of kidney stones, dividing them into two groups, one that ate pumpkin seeds daily and another that avoided them completely. After 12 months, those who consumed over 25 grams of pumpkin seeds per day had a 42% higher risk of stone recurrence. That number alone is enough to make anyone who has suffered from kidney stones shudder. The study's lead researcher, Dr. Martin Reynolds, concluded bluntly, "For older adults with weakened kidney function, pumpkin seeds are no longer a clean food, they are a hidden hazard. Instead of pumpkin seeds, seniors should switch to finely ground flax seeds, a far more kidney-friendly option. Flax seeds are packed with lignans and natural omega-3 seconds that reduce inflammation, stabilize blood pressure, and improve circulation to the kidneys. Most importantly, they're virtually oxalate-free, minimizing the risk of stone formation. For best results, each morning mix 1 teaspoon of ground flaxseed with plain yogurt or oatmeal and eat it on an empty stomach. Grinding the seeds allows the body to absorb nutrients more efficiently, which is especially important for older adults with slower digestion. When storing, use an airtight glass jar, keep it in the refrigerator, and consume within 10 days to preserve nutritional value. Remember, what harms us most isn't always what's obviously bad. It's often what we believe to be good. If you once thought pumpkin seeds were a friend to your health, subscribe now to mark this moment, because from today you begin truly protecting your kidneys. And as you reach this point in the video, I hope you understand why awareness itself can add years to your life. As we pass the age of 50, the kidneys are no longer the tireless engines they once were. Every meal, every small nut that seems harmless can become a challenge for the organs that silently cleanse our blood every single day. Modern research shows that choosing the right foods doesn't just lower creatinine or prevent stones, it's a way to extend the lifespan of every nephron. The frightening truth is that many people still believe eating natural automatically means safe, forgetting that nature has two faces. Some nuts nourish and restore kidney tissue, while others, though seemingly innocent, quietly cause damage over time. The difference between protecting and harming your kidneys can come down to a single choice, a single habit you might not even notice. Your kidneys don't speak, but they respond with fatigue, swelling, or rising test numbers. Learn to listen to your body. Every nut you choose today is a message to your health in the years ahead. Awareness and wisdom are the strongest shields for seniors seeking to preserve their vitality, independence, and peace of mind. The content in this video is intended for informational and educational purposes only. It should not replace professional medical advice, diagnosis, or treatment. Always consult your physician or a registered dietitian before making changes to your diet.